Hello everyone! Have you ever heard of a silent heart attack? Did you know there's a high rate of people who have heart attacks and don't even know when it happened? Many people accidentally discover their health condition during routine medical exams. It's common for patients to arrive at the doctor without symptoms and be diagnosed with severe arrhythmias. Others, with subtle indications of heart problems, are diagnosed with heart failure, among other conditions. A heart attack, even if symptomless, can have serious effects. Fortunately, the person survives, but can develop arrhythmias, cardiac weakening, or even sudden death if untreated. Therefore, it's crucial to recognize that, despite being called silent, a heart attack may show subtle signs and symptoms that should not be ignored. Follow the video until the end to understand the differences between the signs and symptoms of a silent heart attack and a common heart attack. Let's get started. Traditional heart attack. In a common heart attack, widely known, the symptoms are typical, strong, and easily identifiable. The pain of a heart attack is usually described as a squeezing or persistent burning for more than 20 minutes, which can radiate to the inner arm, chin, or stomach. Often, it is accompanied by cold sweat, with sticky skin and intense perspiration. Nausea, shortness of breath, and feelings of dizziness or impending fainting are common. In severe cases, the intense pain can lead to unconsciousness. It's important to note that the intensity of the pain can vary among individuals, and in some cases, especially in women and the elderly, the symptoms can be less obvious. This type of intense pain usually makes the patient hold their chest and seek medical help immediately, highlighting the urgency and severity of the situation. This is the classic pattern of heart attack pain, silent heart attack. The silent heart attack, also a type of acute myocardial infarction, resembles the common heart attack in terms of cardiac damage. However, in this case, the classic symptoms are not evident, leading to a delay in diagnosis, as the patient does not seek immediate care and often only discovers the condition during a routine checkup or when beginning to feel mild symptoms of a previous heart attack. During an electrocardiogram, a common test, a past heart attack can be identified through the pathological wave, a change that indicates a possible previous heart attack. The silent heart attack varies among people and can be mistaken for common malaise, presenting symptoms similar to other diseases. It's important to emphasize that, in many cases, the silent heart attack occurs without any noticeable symptoms, increasing the risk of long-term complications. Thus, attention to subtle signs and regular heart exams are essential, especially in individuals with risk factors for heart diseases. Number 1. It's crucial to remember that, in the case of a silent heart attack, the symptoms are not clear. As the name suggests, it's a discrete type of heart attack with subtle or not so obvious symptoms. Unlike a common heart attack, it's unlikely that you will feel the typical symptoms, like the intense pain I mentioned earlier. You probably won't experience shortness of breath or excessive sweating. Instead, you might feel mild discomfort or pressure in the chest. Some people report a feeling of distress in the chest, mistaking it for stress, and therefore do not seek medical attention. This scenario is quite common. Patients often comment, "Doctor, there was a day when I felt unwell, maybe with a slight tightness in the chest, but it soon passed. I thought it was just stress and ignored it. Could that have been the day I had a heart attack?" Number 2. Some people exhibit atypical heart attack symptoms. Women, diabetics, and the elderly, for example, may have different signs and symptoms from the usual. The heart attack in these people may manifest in unconventional ways, such as indigestion, heartburn, nausea, fatigue, urge to vomit, general malaise, back or neck pain. These symptoms can be easily mistaken for digestive problems, muscular issues, or spinal problems. Think about it. You might have already experienced these symptoms, like chest or back pains. That's why silent heart attacks are more common in women, the elderly, and diabetics. Special attention is crucial for these groups, as symptoms can be easily misinterpreted. Number 3. The symptoms of a silent heart attack usually last for a short duration. Unlike the chest pain of a common heart attack, which persists for more than 20 minutes, the pain of a silent heart attack may last only a few minutes and disappear quickly. Despite the brief duration, this short period of pain can be enough to damage the heart muscle due to the clogging of the coronary arteries, potentially resulting in acute myocardial infarction. This brevity of symptoms often leads many people to disregard or downplay the importance of this sign. It's common to hear reports like, The pain appeared but passed in about 10 minutes. I thought it wasn't serious and didn't seek medical help or go to the emergency room. This kind of reaction can delay diagnosis and appropriate treatment. Number 4. Consider your risk factors. If you have hypertension, diabetes, obesity, advanced age, high cholesterol, elevated uric acid, are anxious or stressed, a smoker, or have a family history of heart diseases, you should be more vigilant as you are more prone to suffer a heart attack, whether silent or not. Therefore, regular checkups with a cardiologist are essential. A good professional can detect the possibility of a heart attack based on symptoms and risk factors. Consider an obese patient, a smoker, complaining of fatigue, back pain, and indigestion. This person needs to be carefully evaluated. Or a diabetic woman reporting neck pain and malaise. Her heart should also be examined. It's important to rule out the possibility of a heart attack, even in the absence of chest pain. A simple electrocardiogram can reveal changes from a silent heart attack, and tests like the measurement of cardiac enzymes can assist in diagnosis. A proper evaluation can save the patient's heart muscle. Remember, time is muscle. The severity and extent of myocardial ischemia can change radically with quick and appropriate intervention. This includes the patient's rapid arrival at the hospital, effective treatment until discharge, early opening of the blocked artery, and timely administration of medications. All of this is crucial to protect the patient in a heart attack scenario. Number 5. The fifth important thing, the silent heart attack, as the name implies, goes unnoticed. Often, then, you only have the diagnosis because it is discovered accidentally during routine exams. It's very important to understand that a heart attack, whether silent or with classic symptoms, can cause significant damage to our heart muscle and can also increase future complications. Among the main complications are malignant cardiac arrhythmias and the dreaded heart failure. So if you have any heart disease or suspect a heart attack, seek medical attention. Well, now you know that the signs and symptoms of a heart attack can also be mild, atypical, so take into consideration your family history and other risk factors I mentioned earlier. Don't let a heart attack go unnoticed, folks. It could cost your life. Often in an electrocardiogram, that pathological wave will appear. Talking with your doctor, considering risk factors, symptoms, he may request some additional tests that will confirm this silent heart attack. For example, in an electrocardiogram, if there's a wave in the inferior wall, the lower part of the heart, in an echocardiogram, that region that had a heart attack will be stationary, no longer beating. Another test is scintigraphy. In scintigraphy, the region that was infarcted will be more bluish, showing that blood is no longer reaching that area, which has turned into fibrosis. No longer having perfusion in that area, it will be a darker region. In the cardiac MRI, the area that had an infarct will form a scar, fibrosis. So there are various complementary tests that can be done if necessary to really confirm a diagnosis that the patient had a silent heart attack, which is that heart attack that he did not notice, did not have to go to the hospital, or failed to go to the hospital because he thought at that moment he didn't need to, was not having a heart attack, did not need to have gone to the hospital. So, look at all this information. Don't forget to like, subscribe to the channel, then click on the bell to receive all notifications, and, once again, don't forget to share with your friends. So, I'll leave it at that. That's the message for today. A big hug and see you next time.